Almost all adults know that they have joint problems, but not everyone understands why this happened to them and what needs to be done for recovery. I'm Dr. Vasyl Chaika, and in this video, I'll tell you what you need to do and how to do it correctly so that your joints stay healthy. So first, you need to understand what a joint is and why our body needs it. A joint is a structure that provides mobility to a certain part of our body, and its construction is actually very simple. There is one bone, another bone, and between them is a gap filled with fluid, all surrounded on the outside by the so-called joint capsule or joint bag. And depending on the shape of these bone surfaces, different movements occur. For example, you see fingers can bend. These kinds of movements are considered physiological. But for instance, bending them backward is non-physiological. The shoulder is our so-called ball and socket joint. That's why we actually can't describe it. That is, depending on the shape of the joint surfaces, a certain range of motion is provided. The most common problems of the musculoskeletal system are two diagnoses. These are arthrosis and arthritis. Here you need to clearly understand the difference between them. Arthrosis is considered a degenerative dystrophic disease. A lot of fancy words, but what does it actually mean? It means the destruction and restructuring of the very structure itself. Of the bone, meaning the formation of additional bone tissue. Defects appear somewhere in the bone tissue, and at the same time, there is practically no inflammation around the joint. And then there is arthritis, which is what we call an inflammatory process. Just so you know, whenever you see the ending oitis, like arthritis, rheumatoid arthritis, polyarthritis, sigmoiditis, whenever there's an itis, it means it's an inflammatory process. That's why there's inflammation of the surrounding tissues, the joint swells, there's swelling around it, there's an increase in body temperature, redness, and in both cases there is pain. So these are the two diagnoses. And of course, from the perspective of classical medicine, the main issue here is either an infection in arthritis, where it attacks, or some kind of autoimmune process. In the case of arthrosis, it's considered to be some chronic problems, autoimmune deficiency, or something else they might mention, or genetics, for example, if your grandmother, mother, or someone else had it. And now, the treatment for all of this. So what is the treatment? The treatment is the same. It's non-steroidal anti-inflammatory drugs that simply relieve the symptoms. After a certain period of time, we use injections of certain substances into the joints, mainly hyaluronic acid and its derivatives, and then joint replacement. That's the life cycle of our joints. Let's analyze from a comprehensive approach what is wrong here and what really needs to be done so that even if you already have changes in your joints, they can become healthy. From a comprehensive approach, our entire skeletal system, bones, muscles, blood vessels, ligaments, is controlled by substances in the brain. That is where the control centers for each joint, each muscle, and each muscle group are located. And so, if certain changes occur in the surrounding environment, or if we perceive this environment in a certain way, the brain gives a command, and our joints and the entire skeletal system begin to change. How does this happen? When we perceive ourselves as being worse, as if we can't handle something, when we fail, when we feel defective, not like others, not as good as someone else, someone who jumps higher, runs faster, or learns more quickly than we do. In other words, all of this is what we call low self-esteem. When we perceive the world this way, or when a certain situation arises, a specific area of the brain immediately reacts. It sends a command to the corresponding joint, and the joint begins to change accordingly. How does this happen? Adrenaline, noradrenaline, and cortisol are released, causing capillary spasms, and bone regeneration essentially stops. If this process continues for months, a condition called osteoporosis will develop in that joint. Therefore, everyone should clearly understand that osteoporosis does not occur due to improper nutrition, calcium deficiency, or anything like that. The last question arises because there is a decrease in one's self-esteem in relation to the surrounding world or to oneself. This is the active phase of the so-called connective tissue reflex. Next, when the reflex ceases its activity and a person raises their self-esteem, for example, someone praised the person managed to walk 100 meters, even though before that they thought they couldn't do it. That is, something positive needs to happen where the person raises their self-esteem. As a result, the process of recovery and healing will begin. And how is any healing in our body characterized? By the accumulation of water and a condition called inflammation. And what appears is swelling, pain, and an inflammatory process around this joint. So it's very important to understand that when an inflammatory process occurs, the joint swells and pain appears. It's not that the disease has attacked the joint, but rather that the recovery process has just begun. Now let's take a closer look at what conditions a person must be in for this situation to occur. In other words, a drop in self-esteem. We describe it exactly like that. I consider myself worse. Biologically, this is described as a reflex. Just like when you pull your hand away from a hot frying pan, this is a separation reflex. Or it's also called separation. When a person is forbidden to walk, don't jump, don't run. You can't because you have a weak heart, you're taking on too much. Look how skinny or small you are. Sit in the office, don't move. It's dangerous out there, and so on. In other words, our environment shapes our perception of the world, where you always have to be careful because something might happen. Or, for example, a person gets injured during some sports competition, say a fracture or a crack. And so, when this situation happens, there's a perception that I've become somehow different because now the joint won't be the same. I'm not the same anymore. I can't run 100 meters. Because, for example, I get short of breath, it's hard for me to run, and the doctor also said I shouldn't. And now I live with the perception that I'm somehow not like everyone else, not like the others. Because I see how others run and jump. Well, it's enough for me to walk those 100 meters, enough for me to run a little, enough for me to go, for example, and do some sport I haven't done in 5 years. 1 day, 2, 3, 4, 5, and I start to get the hang of it. That is, wherever I can express myself through my athleticism, where I can once again show that I can move like I used to, the process of joint recovery will immediately begin, which will be characterized by inflammation. And here's a very clear point. Arthritis, that is inflammation of the joint, is actually the beginning of the joint recovery process. And here we need to approach this very clearly from a comprehensive perspective so that this problem doesn't become chronic, so that these pain syndromes don't last for decades or even longer. Let's break down what needs to be done when such a condition arises. So, from the perspective of a comprehensive approach, the first thing we tend to think is that we need to do something, maybe eat something, maybe drink something, maybe apply something. That's all incorrect. First, we need to understand that the appearance of pain, discomfort, swelling, stiffness, or inability to move, especially when this situation arises in the morning, meaning we went to bed and in the morning we're experiencing all of this, has worsened or appeared. This is not the beginning of a disease, but rather a biological, physiological process of our body's recovery. And now we need to go through it correctly. So first, it's about understanding. And so, as soon as you feel any discomfort in the morning or pain in a joint, or it swells, or the temperature in it rises, the first thing you should do is praise the joint. Because finally, the correct recovery process is happening. I finally raised my self-esteem a bit. I started to feel better about myself. So you should stroke your joint and praise it. And you need to do this constantly, at least 50 to 60 times a day. Say, oh, my joint is doing great. Oh, how good all of this is. Oh, I know you're healing. I know you hurt me a little. Or there's some discomfort, but I know that's how healing happens. So you're doing great, and I'm doing great for understanding this. Why is all this unnecessary? Because as soon as we start perceiving the healing process, which goes through inflammation, as a problem, oh, I can't move, oh, I have some limitations, oh, I'm not like I used to be, we go back into the active phase of the reflex, where adrenaline, noradrenaline, and cortisol are released again, and the recovery process stops, and so on. The idea of bone destruction. But many of you will say, does it really work like that? This is something unclear to us. I want you to understand how this works and how quickly it works. Now, please, everyone imagine a lemon. A yellow, fragrant, sour lemon. You take a knife and carefully slice the juicy lemon wedges. You take one of those lemon wedges and put it in your mouth. And your mouth starts to water. How long did you have to wait for your mouth to water? Maybe a month, maybe 2? No. Right away, your mouth starts to water. That's why I want you to understand, as soon as you perceive that something hurts, that you can't do something, that it's hard for you, that it limits you, that you're somehow not right, that you're fed up with it, right away, adrenaline and noradrenaline are released, your capillary spasm, and the recovery process stops. So you are actually harming yourself. That's why the first rule is always to praise your joint or the affected area, to acknowledge that it is healing and that it is healing in this very way. Next point, this is about the pain itself. Pain does not occur because your joint is being destroyed, since the bone itself does not have pain receptors. There is nothing there to hurt. So why does pain occur then? It's because the bone is covered on the outside by the periosteum. And when fluid is pumped in for recovery and to allow calcium to reach the area, it is the periosteum that gets mechanically stretched. And that's why pain arises. The degree of pain depends on the amount of fluid and the area that needs to be restored. Pain doesn't mean that your bone is broken, it means that the recovery process is underway. Of course, we can reduce the intensity of the pain itself. How? By reducing the amount of water there. How can you do that? That's right. You need to reduce your water intake to 300 to 500 milliliters per day if your joint hurts and there is an inflammatory process. No more than that, because the more you drink, and this is the mistake people make, because doctors recommend it, it leads to the pain becoming more intense, and usually then they prescribe painkillers. So the second rule is to reduce the amount of fluids to 300 to 500 milliliters per day. The next point, another way we can reduce swelling, is cold. Do not warm the joints, because that will increase the swelling. Specifically, we can use cold when the swelling is significant. If the swelling is minor and the pain is not intense, we can make a so-called saline bath. When we take for 100 liters of water, we add 900 grams of salt. The water temperature should not be hot, but rather at about our body temperature, which is 37 to 38 degrees Celsius at most, no higher, because if it reaches 40, the swelling will increase. And you should stay there daily if your joints hurt for 1.5 to 3 or even 4 hours, however long you can manage. But at the same time, it shouldn't be too hot around you. This will also help reduce swelling. What else can we do additionally? We can take herbal remedies that help remove excess water. It doesn't matter what they're called. These are plant-based diuretic herbs, teas, and so on. Once a day. Additionally, we can also do measured physical activity, or what is called joint gymnastics. There are a huge number of options for this joint gymnastics. Every author offers their own miracle method, but the essence is very simple. It's just movement in the joints. And here's a simple example for you. Here I have a thumb on my right hand, you see, and here I have one on my left hand too. They're different. Why are they different? Because this finger is injured, its joint is shattered. Once when I was a child, we were playing and I put this finger in a gate and it got crushed and the joint was shattered. So what did I do to restore the joint? Basically, what I'm telling you now is passive. If the pain is very intense, you do passive movements. That is, you take the joint itself and gently start bending it to the point of tolerable pain. If the joint bends on its own, you can do any physiological movements for the joint yourself. Movements like these or these are enough. Move the joint as much as it allows you to. This is the essence of joint gymnastics. To what extent should you tolerate the pain? If you can, let's put it this way, just tolerate it, that will be enough. But if the pain suddenly becomes sharp and intense, reduce the intensity. And if it hurts so much that you can't even move, then what? Either passive bending or just lie down and once again praise your joint for healing, doing the 2 steps mentioned above. Additionally, what else can we do? This is to improve lymph and blood flow. For this, we can use, for example, applying vacuum cups to large joints. There is also a method called gua sha massage, where by scraping we create a so-called artificial hematoma, lymphatic drainage massage. And there is also what is called shock dynamic therapy. Its essence is very simple. You can do it with your hands, or you can use certain objects, for example, a ruler. It's very simple. For example, if a joint is bothering you, you just gently tap around the joint with light patting movements. That's all there is to it. That's enough. No force is needed. Here, do it 20 to 30 times around your joints. You can even make it a practice in the morning. When you wake up, if you have some free time, to pat each joint like this 15 to 20 times. That's it. That's enough as well. But remember, you should also praise yourself while doing this. Next. So, what should you eat? Maybe there is some special diet? There isn't. For the recovery process, our body needs just one substance. That is protein. So when you have joint problems, you need to increase the amount of protein in your diet. The recommended amount of protein is considered to be 1 gram per kilogram of body weight per day. But if you have joint problems, you should consume 1.5 grams per kilogram per day. This applies to both adults and children alike. That's all there is to it. By following these recommendations, by following this very simple algorithm, you will get rid of the pain you have. You will create the conditions for your joint to recover, you will restore your mobility, and most importantly, you will forget about visiting doctors. This was Dr. Vasyl Chaika with you. Until next time.